Hey you guys, in this lesson we are going to be talking about Pediculosis Capitis or head lice. And I just want to apologize ahead of time because you are 100% going to feel like your head is itchy by the end of this lesson. So just be prepared for that because it's happening to me already. Okay, so head lice is a very common problem for school-age kids. And what happens is the bugs infest the hair and the scalp, and then they lay their eggs. And then it's all transmitted to other people, other kids, through contact, which is usually through personal items like toys and hats, coats, hairbrushes, all the things that kids are sharing in a classroom. So the first picture you have here is of the actual louse or the actual bug. And the bug itself is small, and it could be gray or tan. It doesn't have wings. And they're not really visible to the naked eye, but you can, on assessment, if you're looking at a child's hair, you might see a little bit of movement. The second photo here is of a nit, or that's just the egg of the louse bug that you see there. And most of the time, what people find when they're assessing or they're trying to determine if a child has head lice, so again, they may see movement, but the thing that they're most likely to see is that they find these little white eggs attached to pieces of hair. And the little eggs, they're white and kind of oval shaped. And there's no fancy test or diagnosis to picking up on head lice. It's just all about visual detection of either the bug or the nit that you see there. If you do suspect lice, or if you're a school nurse and you're checking the heads of kids, it's really important to make sure that you are wearing gloves when you do that, because it's obviously very, very contagious. Okay, so what do we do if someone does have lice and we've picked up on a school-age kid that has this problem? So most medications that we use for treating lice can be gotten over the counter. And a really common one is the permethrin 1% cream. And there are a lot of them. And so if you're talking to parents about treating head lice, you want just to instruct them to use or go by the instructions that come with the medication. But the permethrin is really common, and it's one of the ones that requires 2 applications. And the reason for this is because it does not kill the eggs. It kills the live bugs, but it doesn't kill the eggs. So you're going to want to apply it a second time about 7 to 10 days after the first application. And that's because that's when we're going to be able to kill the eggs that were left and have since hatched. So you may be asking yourself, if we have medications that are over the counter, why is it so difficult to get rid of? It's very common. And honestly, guys, I get a message like once a week from my kids' school about lice. And the reason for this is because it takes a lot of effort and just serious vigilance to get rid of these determined little bugs. And there's also some evidence that the lice are actually becoming resistant to the medication. So in order to really, really make sure that they're gone, parents have to actually manually remove those eggs. So they have to go through the hair and comb through it with a fine tooth comb and make sure that they're removing those little white eggs that are stuck to the hair follicles. And sometimes they can just really stay on there, so you have to just remove them manually if the comb isn't actually working. And you just have to do that quite often and just make sure that they're doing that until they're 100% gone, so you can tell that it's a lot of effort. So once you've gotten that out of the one child's head, you then have to go into the classroom and try and get all the eggs and bugs off of the hats and scarves and coats that are piled up in the classroom. And so that type of prevention is also really difficult. So obviously we can't just spray the whole room with pesticides. So actually all of those linens and clothing need to be taken home by the child and washed in very hot water. Any hair care devices need to be soaked in boiling water for 10 minutes. And that's going to help kill those bugs and the eggs as well. And anything that can't be washed needs to be sealed in a Ziploc baggie tightly for 2 weeks. And this is so that the eggs themselves actually will die while they're in there and sealed in. And this isn't, so you can see it's not an overnight solution. It takes time and it takes effort. Another thing to know about therapeutic management is that sometimes kids and parents can get really embarrassed by this diagnosis. So it is important to tell people that head lice actually, it just can happen to anyone, and it's not at all associated with cleanliness or socioeconomic status. So definitely make sure if you're a school nurse or if you're, teaching a class about this, that you make that point very, very clear. So your priority nursing concepts for a patient with pediculosis capitis are going to be infection control and then tissue and skin integrity. Okay, guys, that's it. Pretty straightforward. Your key learning points for this lesson are to first, just know that it is a common parasite for our school-age kids and that it's spread through contact with infected personal items. Second is to remember that we are treating it with medications like permethrin 1%, but that they can be really tough to get rid of. So medications very likely need to be followed by manual removal and then making sure that we're treating those items that have been infected. And then number 3 is just providing emotional support. Like I said, it can be embarrassing, and we want to educate kids to prevent any kind of bullying that may be going around this particular diagnosis. Okay, guys, thanks for joining me for this lesson. Hope that you're not itching too terribly badly after listening to that. But make sure you check out the resources that we have attached to this lesson. And now go out and be your best self today, and happy nursing.